The only thing difference about my job and your job is that I can't formally diagnose.
Hmm.
But I would say a PTA is very similar to what a PA is to a surgeon or a
Hmm.
DO or an MD,
Hmm.
right? They need to know just as much about that patient as you do. And I think this is how we make better change, is to start these conversations, to get to know each other. I know you said you felt intimidated by those PTAs, but remember, they've been out of school for a while. So, like, it's expected that they know a little bit more, but that doesn't mean you don't bring value to the table either. I think the collaboration of different years of experience is going to help us as a whole.
Hey everyone, Gerardo here, physical therapy student and founder of Rotate Clinical Housing Solutions. Are you stressed about clinical rotations? Don't worry, we got you covered. Today we'll be talking to Margie, physical therapist assistant and home health guru. She calls herself your big sis PTA, and she's got a lot of great experience you don't want to miss out on.
I want to get to know you a little bit better in terms of where you went to school and how many years you've been out.
So I'm a PTA. I actually got my bachelor's degree first in exercise science at Old Dominion. And
Mhm.
then I took a couple of years off. I worked all types of jobs. And
Mhm.
then I went back to do the PTA program at my local community college, which is Northern Virginia Community College.
Mhm.
And the program was about 2 years, and we had three rotations total.
Mhm.
Graduated in 2018, and I did outpatient for the first year and a half, 2 years. And then I switched over and I did home health, like PRN. And then I switched
Mhm.
over to home health full time. And I'm still currently full time with home health. I just work multiple contracts or PRN jobs so that I have
Mhm.
a full load.
Oh, awesome. So you've been a little bit of everywhere. That's what it
Yeah,
sounds like.
pretty much.
Um, and then for the clinical rotations you've
Mhm,
completed, what were
mhm.
the settings like?
So I had two outpatient rotations, and then my last one was in acute care at a hospital.
Mhm. And for your school, what was the selection process? Like, did you guys have a say, or was it more of a randomized or lottery system, or?
We get to like rate our preferred setting, but
Mhm.
our one of our professors takes care of all of the, I guess, assignments for a rotation.
That's cool. Were most of them pretty local, or did you? Yeah, yeah.
Yeah, they're all like, I think she tried to get it in within anywhere. I think the furthest somebody had to drive was maybe like under an hour, but everything was pretty local.
Oh, that's really nice. Yeah,
Hmm.
because some of the concerns I've been hearing is PT students or students in general getting placed in locations out of town or out of state and having to resort to some of their family members that they might know out there, or just having to research a new area completely. So that's pretty
Hmm.
nice that you had all your rotations in one
Right,
area. It's one of the biggest
exactly.
struggles. Awesome. Was there any main takeaways that you learned from either a rotation or a CI? As far as the PT students, the rotations are there to get hands-on practice, get some feedback from a CI. What are is there anything that kind of stuck out to you with any of those rotations that you had?
I think outpatient, because I was a PT tech, went for on and off like 3 years, different
Hmm.
clinics before I did the
Hmm.
PTA program. Outpatient setting was very familiar. I had great CIs. All three of my CIs were great. My last rotation was acute care, and it was like a major curveball. I was just like, because I said I really didn't want to go into a sniff, and I guess the
Hmm.
only other option was like either rehab or an acute care. And
Yeah.
this acute care rotation only takes one student a year, and I
Hmm.
so happen to be the lucky one, I guess. It was the probably the
Yeah.
hardest one of the hardest things I had to do in the program, but it definitely made me grow as a clinician, as a student. I think
Hmm.
without the acute care rotation, I probably wouldn't have passed the cardio palm part on my board exam. I learned a
Hmm.
lot.
Yeah.
First week, it was a lot of getting acclimated to the EMR. Hospital, you can run around all over the place, all type, up and down floors, versus
Hmm.
a patient clinic, you've got like one gym, one
Yeah.
bed or whatever. So it was a lot to learn, and I didn't think I was going to do well in it, but I ended up really enjoying. I learned a lot, and I had a
Yeah.
really good CI that supported me.
That's that's a lot to go from one setting to that, and then it's only
Right.
temporary for a few weeks. And I think the beginning portion is a lot about learning the
Hmm.
culture of that work environment, or even the
Hmm.
setup of how everything is, because different hospital systems, different documentations, and even just where everything is located But I definitely would agree and resonate with everything you've said. I got placed
Mhm.
in my inpatient was at a VA hospital, and come midterm reviews, talking to my university, and I find out that they haven't sent anyone out there either. So it was kind of like, oh,
Right.
okay, so I'm trying this
Right.
out. I
Like the
mean,
guinea pig.
I did have a good experience, and having a mentor definitely makes that a big difference. And I learned a lot as well, as whether you wanted to go into that field or not, or even just
Hmm.
at the end, just to be a little bit more confident in my
Yes.
abilities should I want to in the future. Because there's definitely some colleagues of mine that are like, nope, I'm not touching inpatient. I'm sticking to this. I knew what I wanted to do going into PT school, so it's always nice to have that balance. And even to this day, I'm not completely set on one particular location, so I'm pretty open.
Right.
But I did have a follow-up question because I noticed your rotations are pretty spread out, but you're currently in home health. What led you to that path?
So I wanted to actually get into travel PT. I was really burnt out in outpatient. And
Hmm.
when unfortunately, around the time I wanted to do it, it was when PDPM and PDGM dropped.
Hmm.
If you're familiar with those Medicare, I don't want to call it rules, but something like that
Yeah.
at the end of 2019. So like around October, a lot of assistant positions and travel positions were eliminated overnight. People were stranded in the middle of nowhere,
Oh
America.
my
They
gosh.
had to finish paying for their temporary housing situation, but
Hmm.
they just lost their contract because of this rule. Medicare played a big effect into that. So I had a contract going. I was set up to either, I think it was go to Oregon, and everything was pretty much set up. I just had to get the licensing through
Hmm.
the travel agency, and then it like ghosted me, and they didn't give an explanation why. And then 2020 hit, then the pandemic started, so a lot of clinics either closed down or went
Hmm.
super part-time because of the what is it, occupancy rule.
Hmm.
So we couldn't see 4, 6, 8 patients at 1 hour. We had to be
Hmm.
really one-on-one. And so after a while of March of 2020, I got furloughed, and I didn't even know what furlough was. I had to look it up, never
Hmm.
applied for unemployment, had to look up
Yeah.
how to do that. And I was still doing home health at the time, super part-time, 1 or 2 patients a week,
Hmm.
and they were still going. So I started to dabble into that, did it full time throughout the pandemic. I was furloughed for 3 months in outpatient. And
Hmm.
then they called me back in the middle of summer and was like, hey, we want you to come back. And I think I came back for a month. And I was
Hmm.
like, I hate it here. I really hate it took me leaving to realize
Uh-huh.
that I'm really burnt out. I hate the schedule,
Yeah.
hate the culture of outpatient and the environment. I love my coworkers,
Hmm.
and the pay was pretty crap. So I left. I had a student road. I was a CI for a student's rotation,
Hmm.
and I promised I would finish and see her out. She went through a lot being a pandemic student as well.
Yeah.
So I finished her rotation, and I think she graduated 1 week, and my last week was the following week.
Hmm.
And I've been home health ever since.
Wow, what a journey. Wow, but it sounds like some people might not even notice that they're burnt out or check in, just will go with it. So for you, I think it helped out that you took a break, and
Yeah.
then you were able to go back and see the big difference in your
Yeah.
life and everything. Wow.
Absolutely. I think being forced to take a break or be absent
Hmm.
from work, it
Hmm.
gave me a new lens when I came back. I didn't really know the term burnout. I feel like that really
Hmm.
grew during the pandemic. So when you're experiencing something, but you don't know what to call it, you're just like,
Hmm.
I'm just tired. I have no motivation, no energy.
Hmm.
I feel like I'm always playing catch up at work.
Hmm.
I slowly learned that was called burnout, and big advocate now for new grads and students to really understand what it is and how they can
Hmm.
get out of it. So it was definitely a shock to me. It's kind of like regular medical diagnosis, like have symptoms, but you don't know what it is. You got to go get
Hmm.
tested.
Hmm.
And then when you find out what it is, I think you can better manage it and
Yeah.
understand the ins and outs of it.
Wow. Even personally, I don't think I knew all of that as far as
Right.
you noticing it. But I wanted to touch on an interesting an interesting point you made also, or interesting detail.
There
You were also serving as a CI for a time.
Yeah,
I
I was a
wanted to
CI
know.
maybe 2 or 3 times in the
Oh, okay.
outpatient setting. I haven't had a student in home health.
I wanted to ask how was it moving from recent grad to now being a CI?
Yeah,
Anything you saw in terms of like maybe current students are overthinking or getting too nervous about that from a PI's perspective, see differently now?
I had great CIs, and I know that was a blessing. Not everyone's that fortunate. I've heard
Hmm.
horror stories. I've been hearing in the field like there's not a lot of PTA CIs and not a lot
Hmm.
of diversity in our field between PTs and PTAs.
Hmm.
So it was important for me to give back a program. I said before my first degree was a bachelor's, and
Hmm.
it was a piece of paper, but my community college gave me a career.
Hmm.
So I
Hmm.
wanted to give back to a program that gave me so much, gave me my career. So
Yeah.
I'm always down to take a student. I love taking students. I think
Hmm.
it took me a while to learn certain concepts like neuro, for example, is really hard
Hmm.
for me.
Hmm.
And I love seeing students light up or that light bulb comes on when they
Hmm.
get something, especially with hands-on therapy like manual joint
Hmm.
mobs. Like that really drives me when I teach you something and you get it and you can show
Hmm.
me and you do it
Hmm.
confidently. I feel like that's the best feeling in the world.
Hmm.
To me, it's very important to give back to the community, to pay it forward, whether
Hmm.
that's volunteering to be a CI, showing up.
Hmm.
And my PTA class was very diverse. However, I know a lot of PT and PTA classes are very white. So
Hmm.
it was
Hmm.
important for me to show up, be like, hey, there is diversity in our field and we need you. And it really helps when people see someone that looks like them and they can relate better.
Wow, that was very powerful, and you're definitely giving back to to the profession and to your community, and you're definitely an image in your field, so that's awesome.
Thank
Um,
you.
that's really great. Is there any piece of advice that you would give to maybe PTA students who are thinking about maybe going into home health or might not even know that home health is an option? Is
Right.
there anything, yeah, she would have known?
The home health was not a rotation option for my
Hmm.
program, and a lot of programs, PT and PTAs, I've heard a lot of people don't get to experience home health.
Hmm.
I think you will do well if you thrive on working independently. I miss the camaraderie of an office and the water cooler or break room feel,
Hmm.
but I know that when I work by myself, I'm very efficient because it's just
Hmm.
me. I can't blame anyone else. I can't get sidetracked or distracted. So, you thrive if you like working by yourself. I don't recommend home health for a new grad, whether you're a PT or a PTA, because that first year as a new grad, you're still learning. You're still
Hmm.
soaking it up. It still feels like a clinical rotation.
Hmm.
So, when you're in home health, you're by yourself. There is no supervisor, there is no colleague. You might have a
Hmm.
family member or a caregiver and the patient. So it can be very intimidating. A PT diagnosis well, but when someone passes out or has goes in diabetic shock, those are more
Hmm.
medical emergencies that I don't think a new grad should be worried about. You
Hmm.
should just be worried about total joint replacements, chronic back pain, like the usual PT diagnoses that you see. I
Hmm.
think once you get your feet wet in the field, maybe 1 or 2 years, and you want to
Hmm.
try home health, do a
Hmm.
PRN position. So that means it's
Hmm.
as needed. You take 1 or 2 cases, 1 or 2 visits or patients a week, learn the EMR, figure out how to schedule. Time management is very important in home health. And then
Hmm.
if you like it, then make the jump to do full time or be a contractor full time like myself. And the pay is more than double what I made an
Hmm.
outpatient. So I would encourage, if you're curious, to one, get your experience in physical therapy in other settings such as SNF, outpatient, acute care,
Hmm.
rehab, long-term care, any of those settings,
Hmm.
and really hone in on your skills and
Hmm.
then try it part-time or a PRN if you're interested in home health.
Wow, very, very valuable information. That was awesome. You gave us a step by step what to do even after graduating. You take a few years, get a little bit of experience. And that's interesting. You felt like clinical rotations kept going for a little bit even after graduation.
Because I felt like you won't know everything and you'll never
Mhm,
know everything. If you feel like
mhm.
you know everything in PT, then you're really fooling
There's
yourself.
a problem.
Medicine, technology changes
Mhm,
every day. Things that I graduated and learned
mhm,
for the board exam is now outdated. And I took the
mhm,
boards in 2018. So I would say it's not that you can't do home health as a new grad. I just wouldn't
mhm,
recommend it because I
mhm,
remember when I had to call 911 the first time in home health. And I thought back, man, as a new grad, I don't think I would be freaking out. I
mhm.
probably wouldn't know what to do.
Yeah.
But now, as a more experienced clinician, you see certain things because the PT doesn't change across
Mhm,
any setting. A knee is gonna bend and straighten. That's all it does. So it doesn't matter what setting you treat a knee in. It's the medical diagnosis, it's the medical emergencies
mhm.
that make this setting a little bit more challenging.
Yeah,
And I don't think as a new grad you need that. You just
yeah,
learn PT and learn the nooks and crannies of physical therapy before you go into home health because you're
yeah.
truly by yourself.
Wow, that's great. So thanks for sharing that. There are a lot of people who benefit from getting that little heads up.
Mhm.
Awesome. Was there any questions you had for me? I know that I've been speaking or asking for the
No,
most
I think it's
part.
really
Yeah.
cool what you're doing. I love to see the diversity in the field. I love that you started your page. I think
Mhm,
you have a great thing going and just keep at it because we definitely need more representation in physical therapy as a
mhm,
whole
mhm,
and also as in healthcare as a whole. I know a lot of times when people think of the medical field, it's doctors and nurses
mhm,
and rehab as a whole or therapy as a whole
mhm,
isn't mentioned. And I
mhm,
think that's where we need to be in those spaces so that we say we want more diverse
mhm,
clinicians, but we don't introduce allied health
mhm,
in when there's job fairs or career
mhm.
days. You
Or just
probably don't hear about PT until somebody gets hurt, right? So I think what you're doing, having your foot down
mhm,
for representation in the field is great. And I hope you keep going because it's really important now with the power of social media. Everyone's on their phone. The
mhm.
power of social media can carry you really far.
Thank you. Yeah, that's a lot of what you mentioned was one of the precursors for why I started it, and um, just overall educating the public on their profession. You
Mm.
said a lot of people are surprised when they're like, "Oh, you guys had a take farm," or "Oh, you guys do growing strains," or "Oh, you guys do."
Yeah.
So a lot of it is educational, but at the same time, like you mentioned, representation. But it all started just on a clinical rotation, and I noticed a problem, and I was like,
Mhm.
if I'm dealing with this, there's got to be more people dealing
Right.
with this.
I
And
like that
yeah.
you're proactive about it
Hmm,
instead of
hmm,
like, how come we don't have this or why
hmm,
isn't there this? You're like,
hmm.
well, I'm gonna do it. And that's kind of
Yeah.
how I started my social media too. I was like, there's not a lot of people right now. If you type physical therapy in Instagram search bar,
Uh-huh.
it's all DPT pages, right? Or
Hmm,
exercise pages. It's
hmm,
very limited PTA pages. A lot of the DPT pages are also white colleagues, cohorts, and
hmm,
people of color are not very well represented in the field or on social media.
hmm.
So like, commend you to do it. And I appreciate that you took the time off to get to know what I do as a PTA because a
Yeah.
lot of PTs don't. A lot of
Hmm,
PT thinks I'm like glorified tech. I'm gonna get you ice packs and I'm gonna show them their exercise, but I do a lot because
yeah.
you got to remember I'm your right hand woman. If you
Hmm,
pass a patient on to me, I need to know as much as you of
hmm,
that diagnosis. So I hope people who listen or people you come across be like,
hmm,
oh, PTAs don't do anything, they're not valuable.
hmm,
Actually, if I don't see your patients, you have
hmm,
to see them and you don't get to do new evals. That means you're not
hmm,
bringing new patients in and it slows
hmm.
down
Yeah.
patient care.
Definitely, from
Mhm.
the experience I've had working with PTAs, especially on rotations, because there is a component for PT clinical rotations to have that relationship with
Yeah.
PTAs. And I'm going to be honest, I was very intimidated because a lot of the PTAs that I was there on rotations had so much more experience, and I was like, oh my God, like these guys, I'm supposed to work with them, but they're like top level. But that's awesome. I definitely agree. There's not as much representation, and a lot of it just starts with just breaking that conversation, whether it's
It's
not,
very easy
yeah.
because I think once you get to know what we do, what's in our scope,
Mhm,
we can better help the patient together. And
mhm,
that's what it matters at the end of the day. We're helping the patient. I
mhm,
think a lot of PTs take for granted that PTAs know a lot. Like, took a board exam just like you.
mhm,
I had to go through neuro, three rotations, and didactic work just like you.
mhm,
The only thing difference about my job and your job is that I can't formally diagnose.
mhm,
So, but I would say a PTA is very similar to what a PA is to a surgeon or a
mhm,
DO or an MD,
mhm,
right? They need to know just as much about that patient as you do. And I think this is how we make better change, is to start these conversations, to get to know each other. I know you said you felt intimidated by those PTAs, but remember, they've been out of school for a while, so like it's expected that they know a little bit more, but that doesn't mean you don't bring value to the table either. I think the collaboration of different years of experience is going to help us as a whole.
yeah, thank you for that. All right, Margie. Well, how can people find you, or if they want to connect with you? I know you're doing a lot on your IG. You do a few talks as well. Where can they connect and find you for more information on your journey?
So I'm mainly on Instagram at Not Just a PTA. I have
Mhm.
dabbled, I have a Facebook page linked to it.
Okay.
I am on TikTok, same handle. TikTok's a little fast for me. I feel like an old person using TikTok. So, but you can mainly find me on Instagram. I have a
Uh-huh.
podcast that's streaming on all major platforms, including Apple Podcasts and Spotify, which is Therapy Talk Thursday. I bring
Mhm,
on different clinicians, specifically PTAs, to share their story. I do
mhm,
have PTs that come on. I think it's
mhm,
important for everyone to share their story because someone out there needs to hear it and relate to you. Everyone's experience is different. No matter if we went through the same program together, graduated the same year together, everyone's experience is
mhm,
different, and I think it's important for us to hear everyone's story.
mhm,
And if anything personal or major, I'm on it, Not Just a PTA at Gmail. I love connecting with people
mhm,
online. Social media's power is, I could have never imagined the people I've connected with because of social
mhm,
media. So I would like to think like I'm your like, PTA big sister. When you feel like you have a stupid question you don't want to ask a professor, a CI, or your friends, I'm hope that I could be a resource so you can
mhm,
ask. Because there's no such thing as a stupid question. It's a question because you don't know.
mhm,
I mainly post about home health, and people have been interested in that, but I'm not here to sell anything. It works for me. What works for me may not work for you. Like, you
mhm,
could never get me to work in a sniff. It's not my thing. But if you're curious what a day in home health looks like, I post a lot about that on my
mhm,
social as
mhm.
well.
Great, awesome. Well, thank you again for your time, and thanks for sharing all these tips and tricks and just your journey overall. And wish you the best. And I'm so excited that I had the time to get to know you a little bit better.